Many years ago, I was sitting in choir class, and my instructor asked the entire choir to do the following exercise, or we're going to do that together. He stood up in the front of the room and said, "Hey, everybody, listen carefully. I want you to breathe in as much as you possibly can." Okay? Ready, set, go. Now breathe in a little more. "If you just breathed in a little more, you didn't follow my first directions," he said. And it annoyed me because in that moment, I didn't listen to his instructions. In fact, I didn't breathe in as much as I possibly could have in the first place, right? I had a little left over. And now this is important because if you maximally inflate your lungs, it actually gives you more of a feeling of peace and calm if you're doing deep breathing exercises. So, what does this all have to do with? The respiratory system. So today we're going to go through the respiratory system, comprehensive overview of the structures, the functions, and several other things that you need to know about the respiratory system, okay? And I'll conclude talking about why it is that deep breathing actually makes us calm down. Okay, so let's jump right into it. First off, what are the functions of the respiratory system? Well, respiratory refers to gas exchange. You may have heard of respiration as breathing, but it's really air, gas, exchanging between one place and another. And in the respiratory system, the main goal is to exchange oxygen and carbon dioxide in the blood, okay? So we're going to be bringing in oxygen into the bloodstream, and we're going to be taking carbon dioxide out. And that is because your cells, all the cells of your body, need oxygen to make energy, and they produce a byproduct, carbon dioxide, that we have to get out. Okay? The second thing that the respiratory system does is it regulates our blood pH. This is otherwise known as the acidity of our blood, okay? And your blood needs to stay around an acidity of pH of around 7.35 to 7.45, okay? So the respiratory system is going to help keep it in that range, all right? And we'll talk about how that comes into play later. Thirdly, it's going to regulate blood pressure. Not only in the case of deep breathing decreases your blood pressure, but interestingly, the lungs produce an enzyme called angiotensin converting enzyme, otherwise known as ACE, and that is going to help increase your blood pressure if your blood pressure drops too low, okay? It's a part of the renin-angiotensin-aldosterone system. Nextly, the fourth one, you probably realize, I'm doing it right now, sound production. Moving air through your voice box, your larynx, helps produce sound. The fifth function of the respiratory system is called olfaction. Olfaction is your sense of smell. All right, so in your nose, you're going to have specific structures dealing with sensing smells, odors in the air. And then lastly, there's an immune component to your respiratory system. This helps prevent pathogens from getting into your respiratory tract. So we'll talk about all of those as we go into the structures of the respiratory system, okay? So number 2, structures. We're gonna start outside in to the actual lungs, okay? And at the lungs, keep in mind, that's where that gas exchange is actually going to occur, at the tip of the lung. So let's follow the tract of where it goes before it hits that area. Okay, so starting with the external nose, you have your nostrils, okay? Anybody else flare their nostrils? Your nostrils will bring air into what's called your nasal cavity. All right, we're going to follow this tract a little bit because there are important structures inside your nasal cavity. The structures I colored in orange is the olfactory area. So this will be lined with little neurons that project out into this cavity. They will receive information in the form of odorants. So that is particles that find their way into the nasal cavity, will bind to those neurons receptors, and it'll tell the brain what you are smelling. Really fascinating, okay? If you want to learn more about the olfactory area, go ahead and watch my COVID-induced anosmia video. This is how you lose your sense of smell from COVID, and it'll explain everything about how you actually have a sense of smell and how COVID affects it. All right, moving on. We have multiple structures inside your nasal cavity that almost look like turbines, these little spinny structures, okay? And these are adequately called your nasal turbinates. So why in the world do you think you have little turbines, little spinny bone structures inside of your nose? It's not like you're generating energy from it or anything, but what these do is three things. When air passes through them, the air starts to spin. So the air will warm up, the air will humidify itself, so it'll gain some water vapor, and it will also clean the air. Okay, so in doing so, in spinning the air, it's going to warm it up, humidify it, and clean it. That is really important because when the air travels down into the lungs, it works best if it is warm, humid, and clean. All right, it's a really important concept. As we move down, there will be an opening, okay, in the back of the nasal cavity entering into the throat, and this is going to be called the nasopharynx. This translates to nose, throat, because right below it will be the pharynx itself, being the throat. Okay? Now in front of the pharynx, obviously connecting to the mouth, this is going to be your oral cavity. And the oral cavity is another tract that you can bring air in through. Okay? Now let me ask you this. When you're breathing normally right now, hopefully, unless you're jogging on a treadmill, you're breathing in air right now, whether you know it or not. Which part of your body are you breathing in through? Are you bringing it through your nose or are you bringing it through your mouth? Okay, you probably switched it now just to annoy me, right? But you're probably breathing in through your nostrils, through your nose. Why? Because you're warming, humidifying, and clean it because of those nasal turbinates, right? You don't have those in your mouth. So it's actually better to breathe through your nose. It's better for the air getting into your lungs. Now, at the same time, it's not bad to breathe through your mouth. It's just not going to do those things. In fact, when I was a runner, a lot of the times people would say, hey, make sure you're breathing through your nose and out through your mouth, breathe in through your nose, out through your mouth. I almost suffocated because I was running really fast and I needed more air to get into my lungs in general. So I breathed through my mouth. It didn't warm and humidify and clean the air, but it helped me get more air in. Okay, so it's not a bad thing. It's just not the best thing per se. Moving on, as we move our way down through the pharynx, key point, we can go one of two directions. If we go posterior, it's actually going to go into the esophagus, into the stomach. But in this case, we're going to bring the air into what's called the trachea. This is going to be the windpipe. Now you can feel your trachea all the way from the bottom of your chin here, all the way down until it kind of disappears into your thoracic cavity. Okay, so if you feel that trachea, you can actually feel some little rings around it. So move your fingers up and down, you'll feel these little rings. And those are little cartilaginous rings that I designated in this color here. This is a form of hyaline cartilage, and it is just a kind of a nice strong structure, but it's a little flexible. In fact, you can kind of bend your trachea here and there to pull it back and forth, make some weird noises, right? So it's a kind of a bendy cartilaginous ring, but it's also pretty strong and protective. Now, two other structures in here that I want to talk about. In blue, I have bone, and this is called the hyoid bone. This hyoid bone prevents your trachea from collapsing. And a good connection to forensic science, if this bone is broken, a lot of the times a victim had died from strangulation when that hyoid bone is broken because it collapsed that trachea. Awesome. Well, not awesome. Moving on, this little part I'm going to take a cross section out of, and this is a very specific part of the trachea. This is called the larynx. Okay? Larynx starts with LA because I think of larynx as language. This is where your voice originates, okay? So if I were to kind of do a cross section of your larynx right below that hyoid bone, I would see this sort of structure. In the center, this white part is actually the opening to where air can pass through the trachea. This is the little bits of connective tissue surrounding it. These are your vocal cords. Well, why are they called your vocal cords? Well, cords are kind of these like bendy sort of structures, right? That if you move them, they can vibrate nicely. So on the vocal cord, the little black area right here, these guys will actually vibrate. So they'll kind of move back and forth, back and forth, back and forth, and they'll open and close depending on how much air is coming through. And from those vibrations and from the opening and closing, that's how you produce sound. That's where your voice comes from, in your vocal cords. Wonderful. Now, on top of the vocal cords, an incredibly important structure, you will see a little flap. Okay, and I'm just going to draw it like this just for the sake of simplicity. This is a little flap, and that flap can either close or open the trachea. Close, open this trachea, all right? This is called the epiglottis. So once again, it can close and open. So right now, do you think your epiglottis is open or closed? Well, if it was closed, you wouldn't be breathing, right? Because this would be completely shut off and there'd be no air passageway down to your lungs. So right now, if you're just breathing normally, this epiglottis will be open. Now think, when do you want this sucker to close? Well, think about it. Remember just before I talked about how there's also a branch that goes off into the esophagus down to your stomach? So, if you are eating food and the food goes down the same tube and it has a choice to go to the stomach or the trachea, which way do you want it to go? Probably the esophagus to get to the stomach, right? So, what do we want the epiglottis to do? We want the epiglottis to close when you are swallowing. So that's a really key point. But it'll stay open when you're just breathing normally and talking normally. Awesome. As we move down through the trachea, there will be a specialized area right where it branches off. And this little part is called the carina. It kind of sounds like a dance move, doesn't it? Like the carina? Or maybe I'm thinking of the Macarena. I'm pathetic. Okay, so the carina, this guy is very sensitive. Okay, it's a very sensitive part of your body. And the reason it's sensitive is because if anything were to get into that carina, that's not air, it will trigger a cough reflex. So I know some of y'all, when you're drinking water, you accidentally breathe in. And what does that do? Well, water can actually pass down through the vocal cords because that darn epiglottis didn't close, and it will come down and hit that carina. So water is in your carina. It's going to get down to your lungs. What do you want to do? You want to cough it up. So that's why you can't stop coughing when you have water down the wrong pipe, right? Because it hit that carina, and now it's triggering a cough reflex and pushes everything out through the mouth. Awesome. So carina is a really important structure. Now, once we branch off, these two main branches are called bronchi. And these are the first two tubes that branch off of the trachea. As they get smaller, they will turn into bronchioles, designated in red. Okay, so why are they named these things? Well, bronchi means branch. Bronchiole means tiny branch. Makes sense, right? Anatomy is really not that hard. So as we get into bronchioles, they will branch off into many, many, many different things. You may have even seen, if you have an x-ray before, you may see a faint outline of your lungs. You'll see these little white tubes passing through. Those are your bronchioles. Super cool. Now at the end of the bronchioles, you'll have these tiny little air sacs at the end, and this is where the magic's going to happen. I'm going to talk about those for a little bit here in a second. They are called alveoli. These are your air sacs where gas exchange is actually going to occur into the blood. So these are the sites where oxygen is going to go into the blood and carbon dioxide is going to leave the blood. All right? So that's an overview of the anatomy of the respiratory system. Now, before we move into the alveoli, I want to make something very clear. This entire lining of both the nasal cavity and then the oral cavity all the way down through these tubes are lined with epithelial tissue. That just means lining, okay? So all of that is going to be lining tissue. Now, if you were to look at those cells, they would look something like this. And notice, as the air passes through the cells, we have several little structures here extending from the cells called cilia. And these cilia will all move the dust particles and other crap that could have gotten caught in here, and they're going to move it the opposite direction. Now, why is that important? Well, because the air is going to eventually end up in those tiny little air sacs called alveoli. So if there's dust particles and crap and other things that shouldn't be there, the cilia, as well as some mucus, will be produced to trap those little particles and thus move it up through the respiratory tract until you can cough it out. Okay? So that's a really important structure in the cells themselves that help move all that crap out of the respiratory system. Now, before we move into the alveoli, I had a friend and he was allergic to everything. In fact, just like a bee sting, some foods, tree nuts, etc., would all throw him into what they called anaphylactic shock. I had never known what that was, but they said it was really dangerous, okay? In fact, my friend, Bill, he couldn't breathe if he had anaphylactic shock. And so that made me think, well, what is happening so that he can't breathe? Well, What happens during an allergic reaction is you have muscles surrounding all of your tubes of your lungs, those bronchi and bronchioles. And when you're in an allergic reaction state, there's all sorts of inflammation occurring that makes these muscles constrict. So now your airways are closed up and he couldn't breathe. So could you guess what he had to do when he had the allergic reaction? He had to inject himself, or have somebody else do it, with an EpiPen. Okay, and what the EpiPen does is a little bit of epinephrine. It's a hormone that will travel in the bloodstream and talk to those muscles to tell them to relax, dilate, so they can open up and then breathe right again. I made a YouTube short on this, so if you want to know how EpiPens work, go ahead and check that out as well. And if this has been helpful to you at all up until this point, please like the video so I can get to more people, and subscribe to the channel if you like the content and want more of it. All right, so moving on into the alveoli, which are the air sacs. So if you were to look up the alveoli in an image on Google or something, you'd probably see something like this, okay? So this is really thin tissue, so cells, that are lining the air sacs similar to a balloon, and on those air sacs you'll see a lot of vessels, okay? So these little vessels are called alveolar capillaries. This just means it's very tiny blood vessels, capillaries, in the alveoli itself. Now, if I were to cut that in half like this and look inside, this is what I would actually see. And here's the key point. This is where gases are going to be exchanged between the air, basically the outside environment, and our blood. That is fascinating, right? We are forcing gases in and out of our blood, and here's how. When you breathe in, you're going to bring in a lot of oxygen. And the reason for that is because 20% of the gas particles surrounding you are oxygen. So there's a lot of it in the air. Now, at the same time, in your capillaries, there's actually going to be low amounts of oxygen. And the reason for that is because all the oxygen just got dropped off to all your cells of your body. They used it up. Now it's basically gone, okay? So now we have this gradient established, right? Things in nature like to move from high to low concentrations. So in this case, the pressure of oxygen here is going to be forced high to low into the bloodstream. As it does that, the red blood cells will grab the oxygen and become oxygenated and become red. So here are all your little red blood cells, and they're going to carry all that oxygen to the cells again. Okay, so we just saturated all of our blood with oxygen. Awesome. Now at the same time, what do we want to get rid of again? Well, we want to get rid of carbon dioxide, CO2, right? It's toxic in high amounts. So at this point, we have actually a high amount of carbon dioxide in our blood, right? But think about it. In the air, there's not a lot of carbon dioxide. In fact, it's only about 0.1% of the air surrounding us. So there's relatively low amounts in the air that we're breathing in. Now that is key because now we have, again, a gradient where CO2 will now want to exit into the alveoli and then leave the lungs through exhalation, expiration, okay? At this point, this is when we're exchanging oxygen into the blood and carbon dioxide out of the blood, so that now we have oxygenated blood ready to go to the tissues that is very low in CO2 now. Wonderful. All right, so now that we know how gas exchange occurs in the alveoli, let's actually talk about how we bring in that air specifically through ventilation. So ventilation just means breathing. Simply put, when you're breathing in, it's called inspiration. When you're breathing out, it's called expiration. But how do you actually breathe? Do you suck in the air somehow? In fact, you have no vacuum inside of you to actually bring in air. So the way we do it is through what's called pressure gradients, okay? So before we get started, I have to write a math equation. I'm sorry, I promise it'll make sense. What you need to know is that pressure equals some constant, I'll just put 1, over volume, okay? This is a key point. So if pressure were to increase, volume would decrease. And on the flip side, if volume increased, pressure would decrease. This is just an inversely proportional relationship. So know that if volume decreases, we're going to increase pressure, okay? Which makes sense. I mean, think about it. So if I have this little thing of distilled water, I'm going to close it up, and I squeeze it, what I'm doing to the volume inside is I'm decreasing the volume. And if you were to feel this, there's a lot of pressure that's wanting to come out, right? Because I'm decreasing volume, the pressure inside increases, okay? So how does this relate to the respiratory system? Well, we're going to show this through two different diagrams, okay? This is the lungs when they are not inflated, and this is the lungs when they are inflated, okay? So just a really simple diagram, okay? Obviously, which one has the greater volume? Obviously, this one here. So this is when we're breathing in, okay? So before we jump into this diagram of the lungs, we need to know something about pressure, specifically air pressure, okay? Right now, did you know that air is weighing you down? There is air pushing down on you because of gravity, pulling all that air onto you, and you're getting forced down by that air, okay? And that can be measured. In fact, we are getting pushed down by about 760 millimeters of mercury of pressure of the air. And it's constant, okay? So this air is constantly pushing down on us, just holding us down so I can't dunk on a basketball hoop. I guess that's mostly gravity's fault. But anyway, there's air pressure pushing down on us. And at any given point, that pressure is going to be the same as in the lungs. That's just simply because they're open, okay? It's like two spaces have the same amount of pressure in them, okay? Now, let's think about this. If we increase the volume of our lungs, however, what would happen to the pressure inside of our lungs? So I'll say that again, team. If we were to increase the volume of our lungs, what would happen to the pressure inside of our lungs? Based on this law, as we increase volume, pressure will decrease, right? So now our air pressure in our lungs will be somewhere around, we'll say, 700 millimeters of mercury. Well, what's the air pressure still outside of our lungs? Did we change the air pressure of the earth just by opening up our lungs? No. The air pressure outside of us stays constant, okay? So think about this. If this is the air pressure outside of our lungs and this is the air pressure inside of our lungs, where does the air want to go? Well, the air wants to flow from high to low pressure, so air will flow in because of that pressure gradient. And once the air flows in, then we'll get back to about 760 millimeters of mercury, and it will balance out. That is how we breathe in, okay? Pressure gradients, by opening up our lungs, therefore making the pressure gradient flows into our lungs. The second question is, how do we do this? Well, I drew some things in red, and I bet you didn't even realize it. These are muscles surrounding your lungs. So, these are going to be your intercostal muscles, and this is going to be your diaphragm. So as the diaphragm contracts downward and the intercostals open up and expand, it pulls the lungs with it. Now the reason for this is because the lungs have a little bit of a serous membrane surrounding them called the pleural membrane, and that fluid literally allows the lungs to stick to the inside of the thoracic cavity. So if the thoracic cavity opens, the lungs suctioned to that area pulls with it. Okay? Really key point. So the lungs are stuck to the inside of the thoracic cavity. So if those muscles open up that space, the lungs will open up that space also. And that allows air to flow in. Okay? So that's breathing in. How do we breathe out? Well, you probably already know. If we take our muscles and basically relax the diaphragm, contract back the intercostal muscles, we will get the opposite effect, okay? So think about this. As we decrease the lung volume, what will happen to the pressure in the lungs? Well, it'll go up to about 800 millimeters of mercury. So if air pressure is high, okay, in the lungs, and it's still 760 outside the lungs, air will flow out, and thus the pressure in the lungs will go back to 760 after the air is expelled. So this is how ventilation works. Increase volume, decrease pressure, air flows in. Decrease volume, increase pressure in the lungs, air flows out. Awesome. Now the last thing we're going to go through today is respiratory control. You see, I told you at the beginning to breathe in, and you did that voluntarily. But right now, you're probably just breathing normally again without even realizing it. And that's because your brainstem, the automatic control of your lungs, is constantly going even if you're not aware. Really fascinating. So I have the brainstem right here. And the brainstem will have neurons, so basically signaling cells, that will go out and talk to the muscles of inspiration, expiration, okay? Basically what will happen is there's going to be some overseer neurons, okay, that will basically adjust inspiration, expiration. So for about 2 seconds or so, we're going to stimulate inspiratory muscles. But then after those 2 seconds pass, we're actually going to go and inhibit those inspiratory muscles back and forth, and that is regulated by the brainstem here. Now let me ask you this. If you were to hop up and just go start sprinting, okay, just because you wanted to, what would happen to your breathing rate? Well, obviously it would increase, but why? Did you actively think, oh, I'm going to go for a run, so I need to breathe faster? Well, no, it just happened automatically. And that's because the brainstem is really tightly controlling your breathing. Now, the question is, how does it know when to speed up your breathing and slow down your breathing? It has to deal with your blood pH. What's pH? Okay, this is a really complex topic, but it really just deals with having hydrogen ions in your bloodstream, okay? What's interesting is I haven't mentioned hydrogen ions at all up until this point, okay? So I'm going to skim over the details here quick, but if you want to learn more about hydrogen ion production and how we change things up, so go ahead and watch my Bohr versus Haldane effects video. It'll explain a little more in detail. So here we're going to keep it a little simpler. Hydrogen ions are produced when we have high amounts of CO2. So in other words, when we're producing more CO2, that's usually due to our cells ramping up their activity. Because remember, those cells produce carbon dioxide as a byproduct as they're using and making energy, right? So if you are exercising, are you making more or less CO2? Probably more, because your cells are working harder, right? So exercise causes an increase of CO2, which causes an increase of hydrogen ions. So when you have a lot of hydrogen ions, it's more acidic, and the brainstem will stimulate more ventilation. So you will begin breathing faster and faster, whether you want to stop it or not. Your brainstem will take over and say, hey, we got to breathe faster. Whereas on the flip side, if you have less CO2, less hydrogen ions, it'll become less acidic. This is when you're basically at rest and you're calm and your cells really aren't making a lot of CO2. So therefore, you will have less ventilation. So this brainstem is just controlling, testing the waters, seeing, whoa, is there too much CO2? We got to ramp up breathing. Is there a little less CO2? Oh, we need to calm down our breathing, okay? So this is how we control our ventilation without even realizing it. So at the beginning of this video, I told you that deep breathing and thinking about your deep breathing can actually bring you some calm and peace. And the reason for that is because this same region dealing with breathing has what's called the vagus nerve. And the vagus nerve has a lot of what's called parasympathetic innervation. And if you don't know what this is, I would encourage you to watch my nervous system video so you know what parasympathetic means. But what this means is that you will feel rested and you will begin to digest your food and have just normal, calm functioning. So what's fascinating is when you think about your breathing, you are actively triggering this vagus nerve, which comes and talks to these ventilation muscles. And in doing so, it'll actually trigger this parasympathetic response. And that is why we talk about deep breathing and meditation as a good form of mental health, right? Taking care of yourself. So if you're feeling stressed after learning about all these things in this video, just pause the video, take a few deep breaths, and hopefully you will feel a little better. Hey everybody, Organized Biology here. Thank you so much for watching. If this was helpful, please like the video and subscribe to the channel. I greatly appreciate it. Take care.